My guest today is Isa Herrera. She's a New York City-based holistic women's pelvic floor specialist. She's also the author of 4 books on pelvic health, including the groundbreaking self-help book, Ending Female Pain, A Woman's Manual. She's dedicated her career to advancing awareness of pelvic floor conditions so that more people can find relief from this silent epidemic that affects over 30 million people in the U.S. alone. She holds a BA in psychology and biology from Fordham University and a master's in physical therapy from Hunter College. Her online pelvic education portal is pelvicpainrelief.com. Welcome, Isa.
Well, thank you so much for having me on your show. I am so psyched. We're going to have a good time.
I have to tell you, I've never heard of this. I had no idea what a pelvic floor was. I never knew there was a pelvic floor specialist. So you're going to educate me today along with my audience and tell me how you got started.
Well, they say that, when lightning strikes you and it strikes you hard, you either bounce back or you cave in. And after I had my daughter, I had a beautiful birth, don't get me wrong, but all hell broke loose in my pelvis. And I had no idea, just like you, and probably many of your listeners, I had no idea what the pelvic floor was. I had no idea how to help myself. I had no idea what was going on. And I kept going from one doctor to another doctor to another doctor. And they would tell me that everything I was experiencing was normal. And I'm like, this just cannot be the case. And that's how I decided, and went on a mission to heal myself and cure myself from leaking, sexual pain with sitting, all these things that they told me were a natural part of motherhood. And I knew deep down inside, my intuition told me, this is not right. And I cannot be the only woman in the world suffering from this. Turns out that I'm not. Turns out there's, millions of women with this issue.
But did they not know about pelvic floor? Did they not know, or was it just something that wasn't discussed? Was it something that wasn't taught? I mean, how could so many doctors, who I would assume specialize in women's issues, not know about this?
I know, it's actually really surprising because I ask myself the same question over and over again. And in truth, they don't teach this material in medical school. When you go to the gynecologist, you get, they put the speculum in, they swab your cervix, and they say goodbye, what kind of, birth control you want to be on, et cetera, or what kind of hormone replacement you want to be on. But research has shown that very few actually, even today, palpate and touch the pelvic floor muscles, the area where most of these women are having difficulties in. So I think it's a lack of education.
So you went to school for psychology and biology, and you went to school for physical therapy, but where did you learn about pelvic education?
Oh, wow. Now that's a journey in itself. I've read every research paper in the world. I shadow whatever doctor would let me shadow that had any kind of knowledge in this area, I shadowed. And then what I realized is that our lady parts, and that's, there's so many names for them, they're muscles like any other muscle in the body. And they respond to massage, exercise, breath work. And what I did was I applied the principles that I already knew, the scientific principles and the psychological principles, to an area that basically is a group of muscles, or I like to call it the cradle of our existence, or the first chakra, if for the women who believe in the energy work. So what I did was I just started experimenting on myself and using myself as a guinea pig, and then I took classes, of course, and educated myself in this field. And then, in my office in New York City, I've had 14,704 women come be on my table. But my practice itself has overseen, an additional 52,000. And So after a while, I just said, okay, I get what works, what doesn't work. And then I created these holistic protocols that my team can apply to get women the results that they want quick, because nobody wants to be suffering with us.
So when you started studying this, I assume you had to find out where you could even get this education. And you've worked with these 100,000 women. Do doctors refer you, or how do people find out about you?
You'd be amazed. Once I started understanding that a lot of doctors didn't get it and they didn't know, I would send research articles to them to start educating them. So I would say that I was doing it twofold. I was trying to educate as many healthcare practitioners, and that's why I actually have a program that teaches this work to healthcare practitioners in my online school. But then I also took it to the women. So sometimes they said the best route is the most direct route. So I said, instead of me trying to, I'm educating the doctors, getting them to come around. And now, we have enlightened doctors in New York City who send me patients all the time. But in those days, I did workshops and invited people in and spoke about it. And that's how I started building my practice, one woman at a time.
So what is pelvic floor therapy? What is that exactly?
Well, pelvic floor therapy, the one thing that we have to remember is that the pelvic floor muscles, they're like the conduit, or I like to call them Grand Central Station because I live in New York City, between the upper and the lower extremity, right? So they are deeply affected by everything that's going on in the body. And pelvic floor therapy is a kind of, you do vaginal massages to get the muscles to become more flexible and supple, especially as we age. We need a sort of that vitality to come back into our essence. There's ways to exercise them by doing not only Kegels, because I think a lot of women are Kegling themselves to death and dysfunction, but also how to relax and let go and how to create balance. There's ways to, if you're a really smart pelvic therapist and you're studying with me, how to work on the external muscles so that they also have a profound effect on our essence, our vaginal muscles. So it's basically the same way you would treat another body part, except that it's intradigital work. You're doing the work inside the vagina, or sometimes if it's too painful or there's a lot of vaginal dryness, which happens in menopause, sometimes you have to work interrectally. So it really depends on how the woman presents herself.
So how long did it take you yourself to heal yourself after studying all these techniques? How long did it take, and how long does it usually take with the average person that you see?
Well, for me, it took me over a year because I didn't have someone like me showing me what to do. It was all trial and error. So it took me a very long time. Plus, I had a lot of complexities, especially with scar tissue in the vaginal area. But for an individual person, if they have simple incontinence, and I do call it simple because, there are ways that you can heal this. You don't have to suffer like this. And as we age, these muscles, especially with the estrogen going lower and lower, we need to have more power. So I like, to tell women that they'll be seeing some kind of results within 3 months if they follow the protocol and if they do the work. Now, this is not just about coming to someone like myself and saying, heal me. This is about putting in your work.
Well, that's true in anything. I mean, it's like everybody wants a magic pill. Everybody instantaneous healing and instantaneous results. So what you're saying is absolutely true for just about everything in life. Everybody wants it just right now. But you're right. I mean, people have to put in the work, whatever it is. You've got to put in the work and make it happen. So you talked about menopause. What are some of the common things that happen to women in menopause, especially with their pelvic floors?
Oh, well, I have an online class, healing class, where I show women, and the majority of the women in my class are all menopausal, between 60 to 86, I think is my oldest student. And what I really see a lot in menopause, I see a lot of incontinence, stress incontinence, sometimes urge incontinence. They can't make it to the bathroom dry. There's also a prolapse, if they've had a hysterectomy, which is happens a lot. They can prolapse their organs. So because the pelvic floor muscles are supportive, one of their functions is to hold everything up. When they're weak, things tend to drop down. And so I see a lot of women getting unnecessary surgeries that they probably didn't need to if they had gone to a pelvic therapist or knew what to do on their own. The other thing that I see is a lack of sexual, how do I say this? Sexual response. Like they tell me that their orgasms are dwindling, or they feel like a disconnection in that area. So I said, these are the common things that I hear, and I hear this every day. This is not uncommon, these kind of symptoms that women come in to see me suffering with.
That's amazing that you're able to teach this in an online program. So if I did not come to New York City and there is no one in my area who understands this, I would be able to take your course online and figure out what to do?
Oh, absolutely. What I've done, and I've seen so many women, thousands. What I did was I took the best of the best and I made it specifically so that the woman will understand how to insert her finger inside herself and understand what's going on. Because listen, when you go to the OBGYN, he's not going to do that. Or your gyno may not even do that. So you may have to know what to do on your own so then you can communicate with your medical team, So yeah, absolutely. And I have a live component where I do live Q&As. And so I guide them through the program. I'm just actually about to close up the program now, and then I'm going to reopen it. I go through cycles because it's a lot of women who need a lot of help. And I show them how to do 10 different kinds of Kegels. I show them how to do sensible core work, because the core work that we need in our 50s, 60s, and 70s is not the same thing that a youngster is doing. My core work has really evolved into something so much more intelligent. So I teach them that. I'm a big believer that you have to treat the whole body, that you just can't be focused on the bladder and the vaginal muscles, and that you need to figure out what are the other triggers externally that are contributing to your symptoms, right? So I have this one module, I call it the Reconnected Temple, where you become your own detective. And that's really cool. And I videotape everything because people need, videos in order to understand what's going on.
So what are some of the external things that influence this?
Some of the external things that can influence this, and I call these temple destroyers, because I believe that we're all queens, right? We get to this age and we should be treated like queens. So I call them temple destroyers. And the big one that I find are trigger points, external trigger points that are affecting or contributing to maybe urgency or pain with defecation, because a lot of women have constipation at this age too. Or sometimes I find that these trigger points are giving them back pain or SI joint pain, right? And we all think that there's something wrong with us, but in actuality, the work is quite simple. It's just finding these knots and taming them so that you can control them.
What would an external trigger be?
So the external trigger point would be like imagine a knot that you have in your, like when people always complain about knots in their necks. Imagine having a knot inside your vagina. Okay, that you can get trigger points and spasms in there, which can be contributing to the incontinence. Or a lot of times I find women with a lot of trigger points in their inner thighs. Now, the inner thighs, we're obsessed with our inner thighs as women, but they are connected through the fascial system to the first layer of the pelvic floor. So if there's this harmony there, sometimes you may have pain with, I don't know how, with initial penetration when you're having sex. And so you have to figure out, okay, what is it? Is it dryness? Is it weakness? Is it a muscle spasm? Or is it simply that I just have trigger points in an area that's referring to my sexual disharmony?
Wow, I have to tell you, I've just been so lucky in just so many different areas, not only not having problems with the pelvic floor, but even I had never even heard of, for example, like postpartum. I mean, I never had that. I guess maybe I was too busy to have it. I don't know, but
Hmm.
I just never had any of these issues, and I thank heaven for that. You know, I'm very fortunate. I've had other things happen, but I've just been generally very, very lucky in terms of health. So when you are working with these women, um, what what I guess I would ask you first of all, what is the function of the pelvic floor?
Oh, okay. I call them the five S's of life, the essence of life, right? They're sphincteric, right? So they close off the urinary sphincter and the anal sphincter, right? They're sexual, so they're involved in orgasms, big involvement in orgasm. They're supportive, so that means that they hold up our organs, our bladder, our uterus, our anus, and our intestines, right? Which is why you can have prolapse. And by the way, 49% of women have prolapses. Um, they're also stability, which is why a lot of women wonder why they have back pain and SI joint pain, especially in pregnancy or in the later years. But because the pelvic floor muscles are so weak, they're not stabilizing the lumbar and hip area like they should. And this is one of the functions that everybody forgets because everybody's obsessed with sex and leaking, right? But if you have back pain, if you have pain with your cycles, you know, if something doesn't feel right in your SI joint, most of the time it's due to something happening in the pelvic floor, but nobody looks there, you know? And the other one, the fifth S, is they're like a sump pump. You know, they have a lymphatic function. So many times, if women get varicose veins, or if they're having a lack of sensation, or the catch-all phrase now is pelvic congestion. If the doctors don't know what you have, they call it pelvic congestion, right? And it's sometimes due to the fact that the muscles are too tight because we are indoctrinated to think that we're loose down there. I mean, this is the mindset that I hear over and over again. And so women are doing everything to tighten down there, and then they become too tight, and there's a lack of circulation. And then sexual function becomes worse, and then they start to get more incontinence. So then they do more Kegels, right? And it becomes this crazy vicious cycle of overdoing, you know.
So if women are looking to stay sexually vital, what can they do?
Oh, there's a slew of things. If you're looking to stay sexually vital, and I believe that, you know, at this age, this is something that can be really important. It's really important for us. And I feel like sometimes women turn 50. I know when I turned 50, you know, I was like, oh my God, what's going to happen, you know, with all this? And I realized that, you know, life is not over, first of all. And to stay vital, I would say you really need to really figure out what's going on in your pelvic floor. But I believe that massaging inside and outside will go a long way. I believe in strengthening the core. I believe in strengthening the pelvic floor muscles as long as they're supple and flexible first, right? Because it makes no sense to try to strengthen. It's like you have a contracture and you're trying to strengthen a muscle that's tight. It's not going to get you anywhere. So I believe in creating balance and flexibility first, and then embarking on a strengthening program. And then you can use, you know, women love their yoni eggs and their jade eggs, and they love their vaginal weights. And I incorporate that into my program because if you are an older woman and you like to run, or you like to be very active, or you're playing tennis or golfing, you need more power. You need more power in these muscles.
Well, that's what I was going to ask you. I mean, are there are there exercises that you should be doing, or is there a class at a gym that is better for you than some other class? I know that I'm one of these workout people. I'm one of these. I go every day for 2 hours and I work out.
Oh, good
Uh,
for you.
but there are certain classes I don't like. There are certain classes I can't do anymore because of my knees. But I'm pretty good about, working with weights and moving and all of those kinds of things. So there are classes that I prefer. And of course, I think the greatest thing that ever happened with the insurance companies are promoting these silver sneakers classes. I think that some of the people who take them don't really move enough, but then there are people in there who do get the workout they need. So what kind of exercise or gym work do you suggest?
Well, I definitely believe that you need to be working out at this age, and you need to be lifting weights, okay? And then you need to understand that if you're lifting weights or you are in a class, so I believe in like weightlifting, absolutely, 100%. Um, and then you have to have a balanced program, like you have to work your thighs, you have to work your back, not just your chest muscles or your triceps, which people become obsessed with. I also am a personal trainer for 30 years, so I can talk a little bit about this exercise thing. So you want to create a total body conditioning program. I like those classes. I think they work well. What I don't like, and what I would advise your audience is, if they're becoming symptomatic with an exercise or a class, like say they're leaking if they're doing Zumba, or they feel more vaginal pressure if they're doing another kind of impact exercise, then we have to listen to our bodies and understand that maybe that exercise class you're not ready for, and you need to go back and strengthen your total body. You need to strengthen your pelvic floor, and then you can resume higher level activities. So I'm really big in really creating balance, never holding the breath, all right, because that creates a lot of detriment to the pelvic floor muscles. I don't believe in pushing with defecation or urination. I believe that there's certain behavioral things that you have to do in order to protect your lady parts. But you also have to maintain active, and you have to maintain condition. And what happens with a lot of women in menopause is, if they're having incontinence and they're wearing Depends or pee-proof underwear, whatever the fad is these days, or they're wearing panty liners, they cut back on their activity when they shouldn't. They should be listening to what their bodies can do, and then really knowing how to strengthen their vaginal muscles. Did I answer your question?
Yeah, I think I didn't realize you were a personal trainer. I think that's fabulous, because you can combine everything with what you're doing. But it's I would never even have thought that, because you have this new underwear. As a matter of fact, I found that I was speaking at a health seminar, and I got introduced to that. I didn't even know there was that kind of underwear.
Is that crazy? I find it. I sort of find it insulting in a way, but because I think that women, there's a way to heal this, and there's a way to heal this naturally and holistically.
Well, that's what I'm saying. I can't believe that women, because of this or because of wearing panty liners or whatever, don't exercise. I mean, that's such a crazy excuse. I mean, I can't even imagine that, but that's, of course, my philosophy, because I'm so involved in doing this. But I also we've got about 2 minutes left in this segment, and your book is called Female Pelvic Alchemy.
Mm-hmm.
Find that people understand what that is?
If you understand the word alchemy, meaning turning something to gold, turning something into something that's better, I think that the subtitle describes the book better. Actually, I had a lot of slack about this title, but I liked it so much I kept it. I think that sometimes it's difficulty because I think that there's a misunderstanding among women that the magic sometimes has to stop, that we're not gold, that we are not vital because we hit a certain age and everything is supposed to dry up, like dry up and shrivel away. So that's why I picked this name, Female Pelvic Alchemy, because I thought it was about turning something into gold.
And what is your tagline?
The tagline is trade secrets for energizing your love life, enhancing your pleasure, and loving your body completely.
Yeah, see, that would get me. That would get me, but I don't know about the female pelvic alchemy. That's something I'd have to think about. But yeah, I want to talk a little bit about your book when we come back and find out, what's in it and how long it is, and comments you've gotten from people who have bought it and so forth. So my guest is Isa Herrera. She's a holistic women's pelvic floor specialist. She's written this book, Female Pelvic Alchemy, and she has a practice in New York City. And we're going to continue with her in just a few minutes. We're going to take a break. Stay with us, and we'll be back shortly.